Hello, everybody. This is Gary. Today is Saturday, August 1st, 2020. It is 4:31 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia update for today. Um, I'm doing pretty good today. Just following my daily schedule. Um, I had an appointment with my psychiatrist on Thursday. That was the first time I saw a psychiatrist in person outside of the emergency room in about 5 months. Up until now, my appointments with my psychiatrist have been a telephone conference, and the psychiatrist that I met with Thursday is a new psychiatrist. I had previously had a telephone conversation with him, but this was the first time I actually met him. Um, we agreed that I will be seeing him maybe once every 3 to 4 weeks, as long as I remain stable. As I mentioned in my last video, last week I spent 3 days in the psychiatric emergency room in what's known as EOB, emergency observation beds, where they uh, supervise you for up to 72 hours on what's known as an emergency admission. Um, they wanted to make sure that I wasn't suicidal, that I wasn't violent, and of course, I wasn't really suicidal or violent. Um, Not that I've never gotten into fights before, especially when I was drinking. I haven't had a drink in 20 years. My mother died from alcoholism, so I drank a lot in college and for some time after college. But eventually, drinking just lost its attraction to me, and I just stopped doing it. I haven't had a drink in like 20 years. Um, I'm on 6 or 7 different medications. Alcohol will just really fucking complicate things, make things worse. Um, I never went to Alcoholics Anonymous. I never went to addiction treatment officially for alcoholism. Um, my drinking was binge drinking, so I wasn't drinking every day. But when I did drink, I drank heavily and to get totally smashed. I don't like the taste of whiskey or beer or gin or anything else for that matter. I drank to get drunk. Um, some people claim they drink because they like the flavor of beer. I never liked the flavor of beer. If I drank beer, it was to get drunk. Um, but alcohol lost its allure to me about 20 years ago. Um, I simply stopped drinking. Um, the other habit that I'm struggling with right now is smoking cigarettes. I'm using the nicotine gum and the nicotine patch. I'm smoking about 4 to 10 cigarettes a day. Trying to get that number even lower. But that's an improvement because I was smoking well over a pack of cigarettes every day. And that compromises my mental health in countless ways. Constantly worried about, am I going to get breathing problems? Am I going to get lung cancer? Am I going to get emphysema? Um, so I'm trying to keep my smoking down for now to just a few cigarettes a day. And eventually, I think I will set a quit date and just walk away from cigarettes the way I walked away from alcohol. Um, I'm getting too old for this shit. Cigarettes make people age prematurely. I'm 54, and when I smoke heavily, I feel like I'm 84. I have no energy. I have no drive to do anything when I'm smoking cigarettes. So I need to get rid of these cigarettes altogether eventually. Um, Other than that, I'm doing okay. I went out for a bike ride today. Weather's fairly nice out. It's about 80 degrees outside in Rochester. Sunny out. A few clouds in the sky, but not a lot. Um, Today is August 1st. On August 5th, I have an appointment with my primary care doctor, actually nurse practitioner. Um, and we're going to go over my medications, especially in regards to my stomach problems, intestinal problems, acid reflux, nausea, vomiting. I still have a lot of gastrointestinal issues. I have diverticulitis in my intestines. Um, I have a lot of nausea and vomiting, especially when I get really anxious. I had acid reflux. I have difficulty swallowing. I have esophagus constrictor that often prevents me from swallowing food properly. And the gastroenterologist wants to dilate my esophagus. We have not set up an appointment with that yet, so I'm going to call my gastroenterologist and set up some sort of appointment so we could do the dilation of my esophagus. The food gets stuck in the middle of my chest, not in my throat where I'm actually choking and my air is cut off, but lower down in my esophagus, the food gets stuck, and then I can't drink or eat anything because it just comes right back up because my esophagus is blocked. Um, that makes it impossible to swallow anything unless the food goes down or comes back up. But usually I'm able to drink water and to force the food down. Of course, eating smaller meals and taking smaller bites goes a long way in preventing that, but still, I just want to go ahead with the dilation of my esophagus. Um, that's all for now. I'm doing fine. Taking my medication like I'm supposed to. Um, Comment, like, share, subscribe. Press the notification bell if you want to know when I put out new videos.